Hello everyone. Now today we will explain about how to take the final impression using zinc oxide eugenol impression paste. As we know, we will get our custom tray from the technician. So the first thing we have to do, we have to try in this custom tray in the patient's mouth. So after the disinfection of this custom tray, we have to check in the patient's mouth three important things: the retention, the stability, and the support. The light. This is the way we have to try in the custom tray in the patient's mouth. We have to ask her if there's any pain or any sharp edges that it's harming her. No pain. Then we have to check the extension of the custom tray in the patient's mouth. Sorry. Here we have the label frenum. This is the border, supposed to be 2 mm from the sulcus, as we see here also. So the first thing, we have to check the retention of the custom tray. How we can check the retention? We have to try to pull out the custom tray from the patient's mouth in vertical direction, like this. So we have some kind of retention. Then we have to check the stability. How we can check the stability? We have to put our fingertips, what they call the premolar area, and try to move the denture in horizontal direction, like this way. So we have also good stability. How we can check the support? We have to apply vertical, pressure over the ridge in the maxilla and try to check if the custom tray is moving or displaced. Also, we have good support here. Now, everything is okay. We go for border molding. You can stop. Okay? Okay, hello everyone. Today we will explain to you how to take the final impression using impression material. We call it impression paste, zinc oxide eugenol. As you know, we have to prepare our instruments and our materials. Here we have the custom tray, the upper, the custom tray, the lower, green stick, impression compound, type 1, wax knife, spatula, lighter of course, spirit lamp, hot water, glass slab, and we have the material itself. Zinc oxide eugenol impression paste. This is the zinc oxide white paste, and this is the eugenol brown paste or red paste. So the first step we have to do border molding. Border molding, it means giving the shape of the borders of the final denture. How we can do these things? We can use material we call green stick, impression compound type 1. So the first thing we can do, we have three parts in our impression. The first part is the anterior, then we have the posterior, then we have the post-dam area. Each one we have the right and the left. So in the anterior, we have at the beginning we have to scrub up the wax in this area. Then we take the border molding. Then when we finish, we'll start with the other side. Scrub out the wax, take the border molding. After we are done, we'll start with the posterior, right and left. At the end, we will start with our post-dam area. So we'll explain in detail how to take the border molding of this area. Wax knife. Why do I have to scrub out the wax? In order to provide space for my material. Which material? Impression compound type 1 green stick. This is the way that I have to scrub out the wax actually. Make sure that your wax knife is sharp enough to cut the wax. So now let's scrub out the wax in this area. If you notice, I start from which area? We call this one the buccal frenum. The buccal frenum extending to the anterior till we reach the labial frenum. So this is the right side of the patient. After I finish, I will start with the left one. Okay? You can stop now. The buccal frenum extending to the anterior till we reach the labial frenum. So this is the right side of the patient. After I finish, I will start with the left one. Okay? You can stop now. After scrubbing out the wax in this area, we'll do the border molding using this material. Actually, what should I have to do? I have to soften this material over the flame, not inside the flame, otherwise I will burn it. I have to soften it over the flame. Till it starts to soften. Sometimes it takes time. That's okay. See, now it start to soften. I'm changing its shape.
Okay.
Now it starts to melt. We have the shining surface. Oh. Oh. Then I will use the hot water.
That's very cool.
We call it hot water.
Wait. Okay.
It's cool, but that's cool.
Okay. Now we are continuing with the border molding. Apply it over the custom tray. I'll use the hot water to adapt it into the border itself. Then I will re-soften again over the flame. They put it in the hot water. Then we're putting it in the patient's mouth. Of course, it's not that hot, so it can be used. Okay, now. Okay. Now we do the functional movements. How we have to retract the lip here, outward, downward, and inward, and do massage movements in this area. Till we get the shape of this area. Other side, we'll scrub up the wax again from the labial frenum to the buccal frenum. I repeat again, why do I need to scrub up the wax? To provide space for my compression compound type 1. Okay, this is now the space. Now I'll do the same thing. I'll soften the impression compound over the flame. Decompose.
3.
Now the material start to soften. See now? Then I will use my water Yeah, sure. It's hot water. I'm adapting the material after he put the hot water. I think he forgot.
Sorry, doctor.
Then I will resoften again the material. Dip my finger hot water again. Reshape it. Give it good shape. Resoften again. Reshape it. Then I can dip it only this side in the hot water. Then in the patient's mouth, we take it again. Put it in the patient's mouth. Do the functional movement. I have to retract the lip outward, downward, and inward. Then I will do the massage movements. Which area from the labial frenum till the buccal frenum, in the left side of the patients. And we have to ask the patient if there's any kind of pain. Pain?
No. Early narcolepsy.
No pain. Okay. We are done. We'll take it out now. And this is the second area. Okay.
3.
Now we have the posterior section here. We scrub up the wax from the buccal frenum till the maxillary tuberosity. On the right side of the patient. Okay. Then I have to resoften again the material again over the flame. Okay.
3.
Yeah, now the material start to soften again. As we notice. I will reshape it using the hot water with my finger. Then I will reshape it again over the flame. And I'll use my finger. I'll resoften again. Over the flame. Only this section I have to resoften, but the other it's already done, so no need. Okay. In the hot water, and then in the patient's mouth. we have to do the functional movements. How we have to retract the cheek outward, downward, and inward. As we are seeing, do massage movement. Is there any pain?
Maliki Javati? No.
Okay. Oh, we take it out. And this is the shape. Now we proceed to the other side. Then we'll go for the post down. Now we have to scrub up the wax also on the other side. From the buccal, frenum to the porosity. See now, all the wax is removed for the compression compound.
3,
Now after we scrub up the wax, we'll do again the border molding. We'll soften the material over the flame, you compose.
3,
And now start to soften. I'll dip my finger in the hot water. Make sure it's hot. Then I will shape it using my fingertips. Body soften again. Over the flame. So it's already soft, so now we put it in the patient's mouth. Make sure that we are sitting the custom tray in the patient's mouth in its appropriate way. Then do the functional movements. Pull or retract the cheek outward, downward, and inward. Do the massage. You can also ask the patient to open and close his mouth. Okay, and then relax. Okay.
3,
So now we will take the impression or the border molding for the post-dam area. In this area, if you notice, there is no wax space or why, because here we want to apply more pressure over this area to provide our retention and increase our retention. So we will soften the impression material, impression compound type 1. Okay, you can pause.
Okay.
Now the impression compound start to be soft. Now apply it over the post down. try to extend it. I will flame it. Hmm?
It's about to drip.
Hmm?
Nothing.
This one?
About to drip.
Oh, drip. Oh, here. Here you mean? And I'll re-soften again. Okay, after softening it, put it in the water. Okay. We do the functional movements. We ask the patient to open and close her mouth
வாய் திறந்து திறந்து போடுங்க.
and say ah.
ஆன்னு சொல்லுங்க.
Then-
சத்தம் போடுங்க, சத்தம் போடுங்க.
Then- Then we close the nostril. Ask her to blow over from her
வாய்
mouth.
வழியா ஊதுங்க. No. இன்னும் ஊதுங்க.
Okay. Say ah.
ஆன்னு சொல்லுங்க.
Then we check the retention. The anterior retention, how we can check it, we have to, hold the handle and try to pull it in the downward from the anterior region like this way. Okay? For the posterior, I have to pull it up like this. Okay? So if you can notice the suction, so that means that we have a retention. Sorry. Okay. After we finish, we have to trim about 0.5 millimeter from all over the impression compound in order to provide the homogeneous space with the impression paste material. Okay, like this way. From outside and inside. Make sure not to break the impression compound. For the post-dam area, no need. Okay. After we finish that step, now we will remove the wax spacer before we take our final impression. Why do I need wax spacer? To provide a space for my impression material. What is here supposed to be? Zinc oxide eugenol impression paste. Make sure before taking the final impression, we have to wipe the face of the patients with any separating medium like Vaseline in order to make, not to, to prevent, actually, to prevent the material itself to be sticky to the skin, because this material that you're gonna use it's sticky. So if you do not, apply any separating medium, it will stick to the skin and it would be hard to come off. Okay.
Okay.
We already applied the Vaseline here. Before we take the final impression, we have to wipe out the saliva from the patient's mouth, open mouth, using our gauze. Scrub out the wax spacer. We'll go for the final impression. This is the eugenol. This is the zinc oxide. Just squeeze it over the mixing pad. Then we start to mix it using circular motion. You can just, circular motion till we get homogeneous color. The mixing. Actually, the working time of this material is quite long, so we still have time for mixing. Then we have to load it over the tray. We just yeah. Okay. Now, open your mouth. Open. We put it in the patient's mouth. Make sure that you are applying the appropriate pressure. Then you do your functional movement as usual. Ask her to whistle.
ஊதுங்க பாட்டி ஃபூன் ஊதுங்க வாயை.
Okay. Open and close your mouth.
வாயை திறந்து போடுங்க.
Move her mandible right and left.
கீழே வாய் வந்து பீச்சு சொல்றதுக்கு என்ன ஊற்றுங்க கீழே வாய்
Okay. Open. Then ask her to say ah.
ஆன்னு சொல்லுங்க
Then ask her to breathe or
Breathe
to
out, yeah.
breathe out.
மூச்சு விடுங்க வாய் வழியா
Through her nose. Okay. Now we wait till the material is set. Okay, you can start.
Yeah.
After the setting of the impression material, we try to remove the impression tray from her mouth. See the suction. This is the final impression.